Ritshidze will launch a detailed report into the state of the public healthcare system in the Free State. It says, while the province has marginally improved in certain indicators, it has worsened in many others. Too often, Free State facilities are among the worst performing sites across all provinces, monitored by Ritshidze's community-led monitoring. The report will be presented to the Department of Health and other duty bearers at a community meeting in Batho. Our reporter Aphumelele Mdlalane is on the story. Aphumelele, good morning to you. Thank you so much for giving us your time. Tell us about what really has come out of the gathering that you've seen today, some of the key points about the state of facilities in the area.
Actually, the program has just started now, but like you did indicate that the Free State has worst performing healthcare facilities. That's just what we got also on the ground, whereby we know that Ritshidze, the project, or rather the foundation, is here to give out the report following their, of course, them being here. That was last year. Now they're saying to us that there's more regression than the progress in the healthcare facilities in the Free State. Among others, they are saying the challenge is the shortage of staff and also the distribution of the chronic medication. They are saying that there hasn't been any improvement in terms of that. However, they are here today to talk to, of course, the victims or even the community of Bloemfontein, just to make them understand as to how far have they gone in terms of their report. However, they are indicating that them as Ritshidze, they are here to help the people to make sure that they talk to the relevant stakeholders to improve the issues or the challenges that are faced by the community of the Free State. They did indicate, although, that there's somewhere here and there whereby there's been a progress. However, in many clinics or even on those that are satellite, they are having a lot of challenge in terms of waiting for patients, whereby patients will even want to go back home without their chronic medication due to waiting long. They are saying that they are on the ground to make sure that they strengthen the stakeholder relations in terms of helping, because they are saying that they've realized that there is no healthcare staff that is going to the community, that is going to your elderly people that are unable to come and fetch their chronic medication. What we understand here is that this program will entail in distributing, or rather reporting back through the community as to how far they have gone since their visit in the Free State, and also try to understand, as they will be given a chance, the victims, or rather the people that are here, to talk about their challenges and their experiences in an effort, of course, to make sure that there's improvement here and there. As I did indicate, that stakeholders will be here, that will be including the Department of Health in the province. As we know, it's not the first time we hear such stories whereby the healthcare facilities are regressing. Also, the Human Rights Commission just 2 months ago was in Bethlehem, where they also visited one of the hospitals there and did mention that the issue of shortage of staff is the one that is the most challenging and makes the patients or people that are visiting healthcare facilities to be on the receiving end, as they do complain that most of the time they go back home without their chronic medication.
Serious concern where you have patients that are going into healthcare facilities and not getting assistance because of a shortage. And that's just coming out of the site visit by the South African Human Rights Commission that you're mentioning now, Aphumelele. But talk to me about some of the other healthcare facilities, whether it be some of the bigger ones that are, perhaps in the urban areas. But I'm particularly interested in what you've really noticed about the state of some of the smaller health facilities that are in the more far-flung areas, and how they are doing and the challenges they are facing.
I want to assure everyone in the room.
Not long ago, I must indicate that the Premier Sisintombela did indicate that there will be, of course, a project that will be in place to make sure that it addresses the issue of healthcare facilities in remote areas such as Qwaqwa. That's one of the biggest areas in the Free State that are too remote but has a large population, where people still to date are still complaining about access to healthcare. And the Ritshidze is also here to make sure that there's somehow that kind of an improvement. But I must also indicate that here in Bloemfontein, as much as it is a city, that when you go to the locations, talk to the people, they are still complaining about the access to healthcare, whereby they are saying that yes, there is 24 hours clinics, there's 24-hour hospitals, but in terms of services, there is poor service, whereby they would go back without receiving what they're supposed to be receiving, which is the chronic medication. That is just some of the burning issues or challenges that are faced by mostly those are receiving chronic medication. We are here today to just understand as to how will they go forward now in terms of strengthening the stakeholder relations and make sure that next year when this project comes here to address this issue, there's rather progress than the regression.
Yeah, there's a conversation that's unfolding right now in Gauteng about the city power in Gauteng and in Johannesburg really starting to exempt hospitals and healthcare facilities from load shedding. I don't know what that conversation is looking like in the Free State, but when we talk about struggling healthcare facilities in the Free State, what does that mean for how they cope even when there is a blackout?
So the data in this report were collected.
I can make an example by Aphumelele Hospital, which is one of the biggest hospitals in the province, whereby the Department of Health did indicate that they have contingency measures when it comes to the load shedding. But I must also indicate that in Wopstad, we've heard a lot of complaints from the local hospital and also the clinic that the issue of load shedding is somehow a challenge to them, because patients would be returned home, given that there would be a challenge of a load shedding to some clinics and also to some hospitals. I must indicate that it is still a challenge that is not being able to be confronted by even the Department of Health. However, there is a priority to those hospitals that they know that they are the most busiest in the province, like Aphumelele Hospital, where they've been maintaining that they do have the contingency measures if there were to be a load shedding. We'll just try to understand also here on this program whether they touch on that issue, as it is a burning issue, given that the residents or the patients who would go to hospital would come back and not being serviced because of the load shedding.
Yeah. Well, we'll dip in as well throughout the day as you bring us those proceedings of what that report is going to be as oversight is done on healthcare facilities in the Free State. Thank you so much for that update. That's our reporter, Aphumelele, speaking to us.